Welcome. Thank you for tuning in to Ultimate Potential, a mental health podcast. My name is Tony Mosier, and my co-host is Craig LaMont, and we are here to talk about all things mental health. Over the course of my career, I feel like I've collected some things that could be helpful in sharing.
Yep, Craig. So I'm also a marriage and family therapist and spent my life trying to help people find peace, happiness, vision. I have a passion for about 1,000 different things, and mental health is one of them. I'm particularly excited to co-host with Tony, who's been we have a long friendship, and we've been in business together. We've worked with families. We've cried together. So I'm really excited to try, to put together something that can be meaningful to however many people want to listen.
And we've decided that producing a podcast is kind of like writing a book. You can write it, but that doesn't mean anyone's going to buy it. So Craig and I have decided that we're not going to be nervous today,
right? Because
there's probably going to be 0 people listening to this, right?
my wife might listen, but probably won't. So we'll have maybe we'll have one, right? Maybe your wife.
And this may be the first and last podcast,
that
right?
Might be.
So we'll see how this goes. I'd like to just share briefly about where Craig and I come from. Craig and I are business partners. We've been partners for 19 years. We founded an organization called Telos, which is a residential treatment center in Orem, Utah. Young people from all over the country and all over the world will come to Telos to have a safe place where they can heal, where they can learn skills, how to overcome their mental health challenges, and how to find success and happiness in life. To date, there's been probably literally thousands of families that we've worked with over the course of our careers. I want to talk a little bit about why are we doing this podcast? Who do we think this is going to help?
Well, I think for me personally, Tony, I think for the first time in the history of the planet, I think we have awareness that has reached a critical mass. Yeah. We've got politicians talking about mental health. We have non-psychiatric medical professionals that are being trained in and talking about mental health. But the better part is that our neighbors are talking about mental health. Mm-hmm. The junior highs, the grade schools, the high schools, they all have these little committees, and they're training the students. And there is an awareness that has finally arrived on this planet after thousands of years of human suffering, and an acknowledgement that mental health issues are legitimate and not, some kind of a character weakness or spiritual weakness or who knows what, going back to, demonic possessions or whatever mm-hmm. the belief systems have been in the past. We have this culture, at least in the Western world, but I think it's spreading globally, where mental health is a thing. And with that awareness is a greater sense of empathy. And so the political movements, the 501c3, the charitable contributions, federal and state legislatures are starting to make progress in the awareness of funding, and maybe my insurance friends will be offended by this, but I like to make all sorts of, jokes and snide comments about the insurance world because, we'll go into that probably on some other episode, but even the insurance companies, some of them, are making forward progress about saying, hey, this is a real issue. And I think it's a beautiful thing that the average family can have a child who is suicidal or suffering from some kind of severe OCD or social anxiety or a learning disability, or a parent can have a child who is suffering with opposition defiant disorder, and actually have someone to talk to without this judgmental ickiness or having to hide it all the time. And so for me, this is what I hope is. I hope that our podcast can help people become even more sensitive and more aware, and possibly find some solutions, or at least start thinking about things in different ways. Because, to be honest, there are a lot of ways to do things right in the mental health world, and there's a lot of ways to do things wrong. There's not one right way nor one wrong way, and it's an emerging science, and we're getting better and better and better at what we do in the mental health world as far as professionals and society and governments. And but we still have so far to go. So that's what I hope.
Okay. So for me, thank you, Craig. I went on a walk around my neighborhood. I live on a little loop, a street that loops around on itself, and I know everybody in the neighborhood. I know their kids. And as I was walking along, and I was just looking at each door of each home that I passed, and it occurred to me that in almost every home of these people that live closest to me, there's some kind of a major crisis.
Yep. A
financial crisis, a divorce, a child that's struggling, a suicide attempt. I see our communities as being saturated in suffering, and not to be doom and gloom, but I do see it accelerating.
Yeah.
So my hope is simply this, that the Ultimate Potential podcast will be a means of decreasing suffering for people and increasing joy as it relates to mental health. Now, we will be talking about families who are on the high end of the acuity scale, who are seeking residential treatment for their teens. We'll be talking about families that are looking for resources in their communities. We'll be talking about families that are kind of pre-treatment, right? Mm-hmm. We're going to be exploring a little bit of everything, and so we'll see, how this goes. But today we wanted to start out at a high level, talking about the state of mental health as a whole and what we see is going right and what we see is where we're struggling. And so we have two guests with us today. First is Chris Perkins. Chris is currently, he serves as an executive coach and a consultant to leaders and organizations in the mental health field. He's been serving and leading in that space for 31 years in a variety of different roles, including division president, regional vice president, CEO of an acute hospital, executive director of multiple programs across the continuum of care. He's super passionate about leading and mentoring individuals who want to make a real impact in this area. We're also joined by Rod Andrus. Rod is the founder of Bridge House. Bridge House is a very unique mental health treatment program that caters to young adults and adults who have very complex needs. We all know, or most of us know somebody in our lives who has had, the 72-hour hold in the psych hospital. Some of us has been to visit these people, and we see the sterile waiting room. We see the Tupperware beds bolted to the floor. We see the over-medicated patients shuffling around. And beyond that, we see people in a revolving door, going in, being stabilized, being kicked back out into their communities, only to have another crisis 30 days later and they're in again. And sometimes, this ends in tragedy. What Rod has been able to do is create an organization that has a superior ability to stabilize and assess what's going on with a very complex individual and then begin treating them in a setting. I've been to Bridge House. It's amazing. You'd think that you're in a beautiful retreat setting, a beautiful home. It's serene, it's peaceful, and it has all the dignity that a person would need to heal with all the safety. But the safety comes through lots and lots of staff, lots and lots of people being there to rally around these young people and these adults who are struggling. So Rod is a pioneer in that space, and I'm happy to have him on the podcast as well.
We have something in common between Rod and Chris. They are both innovators in mental health. They have made their history, not just where they're currently working, but throughout their entire work history as being innovators, creative thinkers, pushing the limits on new ideas, implementation of best practice. They have great reputations. And so that's why we wanted these two gentlemen, even though they don't work in the same place and they haven't known each other forever. But we wanted to have them on as our first guests simply because, part of what this podcast hopefully will be is pushing things forward and trying to help people understand the term best practice and continuous quality improvement. Things, they have to get better because it sucks the way it is, right? I mean, meaning the state of mental health in this world. We've got to improve things, and these are the type of people who get it when it comes to always searching for the next intervention that actually works, rather than just a fun idea that feels good.
So on that note, welcome, Chris.
Thank you.
Do you want anything you want to share about yourself before we get into the nitty-gritty?
No, I think you covered it. I think, for the most part, for me, I think the origin story is important in a sense of your why and why you do what you do. Is we're going to talk about families on the high end of the acuity spectrum that struggle. That was my family. I was one of those kids. And being raised by a single mother. Mm-hmm. Not having food on the table all the time, being homeless a couple of times, that sort of started my why and why I'm in this field. Mm-hmm. And most importantly, it's kept me grounded, into what's most important. So, no, I appreciate being here.
Yeah. I have a question for you.
Yeah.
You talk a lot about attributes, character attributes, personality traits, basically, mm-hmm. and how important that is to try to find the right people to actually help. Yeah. So, turning the mirror back on yourself, what would you say the two attributes that you have, number one and number two, that make you so effective in helping people in this space, in this mental health world?
Yeah, I know. I appreciate that. If I was to really distill it down to two, I think it's two that go hand in hand. I'd say it's resiliency and tenacity. Okay. And some people will use those interchangeably, and they're distinctly different, right? For me, growing up in the environment I did, there were times when resiliency was all you had, and you had to just get up the next day and keep moving, right? And at the same time, you had to have this sort of what we now call the Stockdale paradox, where, hey, I'm going to confront the brutal reality of my existence, but I'm also going to maintain faith that things are going to get better and will prevail in the end, mm-hmm. right? Mm-hmm. And if you can toggle between those in times of adversity and stress, and even in good times, I think that the likelihood of you being successful on balance is higher than not.
Thank you, Chris. Yeah. Rod, I'd like to hear your why.
I, too, am grateful for the opportunity to be here with you guys in your first podcast. And if I think about my why, in fact, it's fascinating. I was just having this conversation with a very dear person in my life yesterday, who I don't really spend a lot of time talking about work and how I came to do what I'm doing. And I've thought about this a lot because I've been in the field for over 30 years, but in really diving down and taking a good solid look about what brings me to this field and this work is really just a love for people. I'm one myself. Mm-hmm. I understand the complexities of what it means to be a human. all the difficulties, the joy, the passion, the adversity, the conflict, the pain, the sorrow, and in being a human and being so in tune with that human experience and watching people throughout my life. I can't speak to that attribute that exists in me, why that's so passionate, but it's always been a passion for me. I joke with people as a kid, the only time I ever got in fights was sticking up for someone who was getting picked on. Mm-hmm. And I've always been a fan of the underdog. And one could argue that I was an underdog, similar to Chris, single mom. Mm-hmm. Father left when I was 3. Always wondering if there was going to be food on the table. The similarities are so fascinating. Wondering who's going to take care of me, who's going to listen to me. Mm-hmm. Because my mom was a single mother of 5 children, school teacher. There wasn't a lot of space, wasn't a lot of opportunity for me to really sit down and talk about what it's like to be me in a way that, and so I thought, hey, yeah, my mom always taught us to give, to think of others, and that was engendered in me, and it's a big part. So in a combination of really being fascinated with humans and what it means to be a human, that part of me that was instilled of being caring and compassionate about others is kind of my why, and it's really driven to this work, and it brings a lot of fulfillment to me as well.
So let me ask you, as the founder of a new mental health innovation, a new service, what do you see as the state of mental health in America? You've been at Bridge House for, how many years? 6 years. Mm-hmm. And you're seeing trends, right? What do you see as the state of mental health? In what direction is it moving in terms of young adults and adults?
Well, there's both some positives and some things that I believe could shift and change. And if I look specifically around the work that I'm doing and the people at Bridge House and my partners are doing, it really came from a need of that revolving door you were talking about. And I think our country, as it relates to mental health, has done a really poor job. In fact, I would often use the word abusive to talk about what occurs for people struggling with mental health, where systems that are used to really thoroughly understand somebody aren't happening, where stabilization is happening through a course of sedation restriction in settings that are sterile and institutional, where assessments are happening in a course of 3 to 30 days while a person is restricted, where they're being sedated while they're in the throes of a mental health crisis. And these are the same people who are being labeled as treatment failures, can't metabolize treatment. They are resistant to treatment, versus systems pulling back and saying, hey, maybe we're not doing a good enough job of thoroughly understanding what's occurring with this person. So that's how Bridge House came to be. And the upside behind that is through our mission, and we often get referred to as doing brave work, revolutionary work, and really starting to push the envelope on how assessment is being done to get people to the right level of care so they can be self-sustaining, self-sufficient adults, people on this planet, living a life where they feel connected with meaning and purpose. And so I see hope with that as the message that more people are kind of waking up to what's been kind of going wrong in our world, in our space, and putting energy into start being really creative and innovative about how best to work with people as the individuals they are, the human beings that they are, to try to help them find a life of meaning and purpose.
Being a clinician for the last several decades, the combined experience in this room, it is very validating to see the world waking up to the need of mental health. It seems to be the only thing that people care about right now. And I think that was one of the silver linings of COVID, is it exposed how vulnerable we all are, how much we need connection, and how much we suffer when that connection is disrupted. So Chris, I have the same question for you. What do you see as the state of mental health in America? Maybe primarily among youth.
Yeah, great question. I mean, I would echo first a lot what Rod said in terms of I think the historical approach where we pathologize the patient and the client, I think that that did a lot more harm than good. I think that we're starting to reevaluate old sort of restrictive medical models that have been imposed on this industry. And we've been forced to work within that, right? This whole idea of form follows function, right? The problem has been historically, it's actually the inverse. Function follows form. That is to say, we had to have a function and we had to shove it into an antiquated model and framework. Well, those are starting to break down. And so to the extent of what you're trying to do with this podcast and looking at new ways, creative ways of addressing the mental health crisis, I mean, that's a net positive for our industry at large. Particular to youth, which has been primarily my background, adolescent, young adult, I see a few things, a few disturbing trends, and then a few things I think we can capitalize on. Most disturbingly, as I see, and if I was to use one particular adjective, it'd be disconnection. Disconnection from family, from friends, from extended family, from any type of, however you want to define it, spirituality. I see kids raising kids. Going back to, again, my origin story, my mom said to me, even though she worked 2 jobs, and this has always stuck with me, that if a kid has to look beyond the dinner table for a role model, that child's in trouble.
Wow.
Right. And so, for me, having that stable role model that came home between jobs to put food on the table when we had it and then go back to work, but there was always that point of sort of orientation that we can recalibrate every night at home. Mm-hmm. Right. Yeah. So that disconnection, I watch families in restaurants where you've got mom, dad, the kids are all on their phones. You see it everywhere you go, right? So I see that disconnection lead with young kids into apathy and indifference. I see a lack of curiosity amongst kids today. The world's an infinitely amazing place. And I see kids who have everything before them. I would describe them as they're bored. And when you ask them how they're doing, I'm fine. Hey, what about school? Fine. How about life? Fine. Well, if that's your current reality, what's your future going to look like? Yeah. Right? And so now they have this yearning. They have this emotional vacancy, and it has to be filled with something. So what does it get filled with, right? How are we going to accelerate that dopamine hit they need? Well, that's going to happen through some very maladaptive ways.
Yeah.
Yep.
Whether it's pornography, whether it's, alcohol, drugs, what have you. Yeah. And I hate to say this because there's more context to it, but at one level, can you blame them?
Yeah.
Right? So I think all of those things are contributing to this mental health crisis. A footnote I would add to that, I do think if there was ever a term that needed a definition, it's mental health crisis, because everyone uses it, and I'm not so sure we're all talking about the same thing.
Same thing, yep.
Right.
I agree.
So I think we do need a definition of it, right? And along with those lines is, and I think this is a positive in terms of where we're going in the space, is we're starting to finally see mental health or behavioral health treatment in this country on a continuum.
Mm-hmm. Yep.
And we're starting to properly assess people to go to the right level of care that they need versus a one-size-fits-all approach. So I think that, recently we've had a lot of, there's been an introduction of a lot of capital into our space, a lot of attention and awareness that you mentioned at the beginning of this podcast. I think that's all a net positive. Obviously, there's going to be some shaking out, but at the end of the day, I think that we're going to be able to expedite care and expedite success because people are getting assessed more properly. We're not there yet. And they're getting intervention earlier versus many years ago. And even this still happens today in some locations and what have you, where you have to fail 5, 6, 7, 8, 10 times before we'll pay for treatment.
Yeah,
what have
right.
you. I see that in the Medicaid space a lot.
Yep.
Where you have these very restrictive, onerous regulations around level of care designation. And a child has to fail literally every level of care before they get the treatment that the assessment originally said they needed.
And there's always the risk that one of those failures will be fatal.
Absolutely. Right? Absolutely. Right. And so, and then by the time they get to that level of care, the level of acuity, the level of sort of treatment residue that you have to actually break through is so deep.
Because years of maladaptive adaptation takes that much more time to correct, right?
Yeah.
So there's a theme, and obviously it's our podcast, so we can kind of guide it however we want. But I heard from both of you these insinuations. You use the term, if I can think about it, imposed. You said the word imposed in one of your first sentences, and you talked about, you didn't use the same word, but it was the same kind of, okay, historically, whether it's for young adults or for youth. And I kind of prefaced my bias before, but I almost like to talk about it as a celebration of change that's happening. But who is it that's been imposing? So it's fun to talk about the bad guys in society. We watch bad guy movies all the time. That's always the best sellers, right? The best box office hits. And so it's easy to talk about the bad guys, big oil, or the bad guys in politics, or the bad guys in big farm, or what, like there's all sorts of the bad guys, the cigarette companies, and where it takes 30, 40, 50 years of lawsuits before finally we say, oh, the bad guys are caught. But when we talk about the current problems that we're barely scratching the surface of solving, so many of those policies came from the insurance industry, right? And so we're talking about going back 50 years where nobody has mental health coverage for any reason, and then we have some laws, and we have some. I think it was Clinton maybe that made the first impact on, hey, no, you have to provide some kind of mental health. But that was before the term mental health parity. It was like the introduction. Yeah. And then, like, of course, at least in my view, that the insurance companies started dictating 100%, like who got treatment, where they got treatment, these revolving doors of pathology that you were talking about and that you've been talking about. They all come, it's like you follow the money, you follow the decisions, you follow the, avoiding lawsuits and making more money for the companies that are in that world. And so for me, to be passionate about mental health, I can't separate my disdain and frustration about decades and decades and decades of what I see kind of as the bad guys or the bad players in the world, because the profit-seeking insurance companies that know and have had the research. When I was in graduate school over 30 years ago, we had the research, right? We had the research about mental health. If you're healthy mentally, you have less heart disease, you have less cancer, you have less injury, even like back injuries. You have less back surgeries and knee surgeries and everything else if you can get your mental health right. And the cost of doing this is so much more expensive than the cost of doing this. But the short-term profits, literally the quarterly gains from quarter to quarter for these companies, never allowed what the research was proving. It's been over 40 years that we've known how important it is, right? But we just couldn't ever. So then we get into mental health parity, and then we get into COVID, and we get into awareness, and we get into suicide going from like 5th to 4th to 3rd to 2nd in many states like the Intermountain West, first, right? Like it's the number one cause of death for young people, and now all of a sudden, I think that this is the celebration part. New administrations, new leadership in these organizations, and we're starting to see single case agreements. We're starting to see people who are in those insurance companies, both administrators and frontline caseworkers, who are starting to say, wait a minute, this isn't working, or this isn't right. And even though that's just small, those small exceptions are allowing the providers to literally save lives rather than be stuck in the system. So I want you to talk a little bit about that before, because I'm talking, I mean, it's not that I'm out here to try to make the best podcast, but I think podcasts have to be a little bit emotional and get into the nitty gritty. But do you see the same changes? And do you also share that narrative or not?
Yeah, I do. I think you captured it. I do share the narrative. You really, a lot of people want to find the boogeyman, right?
Yeah.
And whether it's insurance companies, whether it's the government, legislation. in order for my own mental health and my own sanity, though, you can't separate treatment from the money that facilitates that treatment.
Right.
And so you have to work within the system and figure out, okay, what are the needs that they're trying to fulfill? What are their motivations? And then how can we work within that challenge?
That framework.
And I think that one of the things that historically we talk about a problem that our industry did not recognize was not only did we not have good outcomes, we didn't even track outcomes.
Yes.
And so it was just give me money because we're good people.
Yeah.
That, we're mission driven. Give us money.
Which never happened.
Whether or not your recidivism rate was 90% or not or what have you.
Yeah.
Right. And so there was a reckoning within our own industry. If you look at in the SUDS or substance abuse community and what was going on in some of those states and what have you. So I think the first thing is we had to get our own house in order.
Yep.
And I think what we have seen are organizations that are using more validated clinical models, use the term best practice, what have you, that are actually have comprehensive data, research, collection, that analyze that and use it in a quality improvement process.
Part of that celebration of change.
Absolutely. So I think certain forward-looking thinkers in our space have done that and will continue to outperform the industry. And at the same time, the insurance companies, the government has also imposed some leverage on, hey, we need to start seeing this.
Yeah.
Now, the medical community, the med-surg community has been much farther ahead than us on this for lots of reasons.
Sure.
One of which there's it's a much larger market.
Yes.
Secondly, it's kind of like asking the question, what's the difference between a disease and a disorder, right?
Right.
It's bipolar disorder, versus a disease. It's much more easily measured and calibrated. If I go in and I have a broken arm and I fix the arm, okay, it's fixed, right?
Right.
Whereas, some of the qualitative measures we use, that's still a work in progress, but we are getting better.
Yeah.
Right. So again, I do think that that's something to celebrate, but we need to stay focused on it. And I think we still have a long way to go. And I think one of is we start to look at organizations in terms of their legitimacy, their potential for growth and what have you is going to be looking at their QA and QI internal processes.
So providers like us are a key factor.
Yeah.
That we have to prove that what these new innovative interventions are working. We can't just tell people they're working. We have to show them that they're working.
Yes.
Exactly.
Yeah.
Rod, what do you think? What do you have to add there?
First, I had a lot of thoughts about what you're talking about in terms of going after the boogeyman. Who's the bad guy?
Yeah.
Right? And insurance companies can often be given that role. And I certainly think you're onto something. And having been in the space myself for over 30 years, I know I can throw my hat in the ring. I think we can all throw our hats in the ring in terms of contributing to part of the problem, where everybody that's working towards helping has been expected to prove their worth and value. And how do you do that? You have to create some sort of outcome. And that outcome, unfortunately, has been based on trying to, create a bottom line to appease somebody, to appease a family, appease a referral source, appease a funding agency, appease an insurance company at the cost of good care for the people that we're serving and that we're responsible for helping. And if you pull back, and this is the majority of my career, I've been working with adolescents. It's only been with the last 10 years I've been working with adults, with adults, I should say. And it's fascinating to hear their experiences of being in adolescent treatment, where they felt like programs were an extension of the family system, a dysfunctional family system, trying to create an outcome that's going to please the family versus really taking a look at what that individual needs. And I can throw my hat in the ring. I've been part of that.
Yeah.
But as I've had an opportunity to pull back and look at what's been occurring and really take in a good, hard listen, not just look, but listen to what I'm hearing, what's being said to me. So we're going to do some things different. And then getting out in front and pushing the envelope on how to make that change, the celebration of change that you're talking about. I also think, this is the part that's exciting, the unfortunate piece is the mental health. It's around us. People are struggling with mental health. And the crisis you see in your neighborhood, Tony, as you're speaking, it's everywhere. People are being impacted personally every day. As a result of that, I think we're having more people becoming more championing to a need for change. And now I get excited about that. I'm really stoked about that.
Okay, this is fascinating, and I feel like we can talk all day, but I don't want to create a podcast or an episode that is only relevant to executives running mental health clinics.
Fair enough.
Right.
I want to bring this back to
Yep.
the mom at home, the dad at home, the friend, the brother, the sister, the individual who's struggling.
The aunt or the grandparent who's left. Yeah.
We're all suffering together. What I'd like to hear as we move towards wrapping it up today is, what message do you have for those people who are suffering? And what hope do you have for them and for the future?
Well, you've used the word hope. And when you're in the midst of crisis and despair, sorrow, pain, it's hard to see that hope. But based on what I see occurring and what's occurring right now in our world, to try to do some things different, I think hope is something we can start grabbing a hold of. And there's a lot of people, myself included, people in this room, are really trying to champion hope and to create opportunities for people who are struggling to find what it is they need, what they're looking for to help themselves, help their loved ones get the care that they need, so they have a sense of hope, that they can have a meaningful life that's, fulfilling, connected. Yeah.
Thank you.
You're welcome.
Thank you.
Excellent.
What about you, Chris?
I guess the first thing I would say is I think there's a trend currently in our society right now to move away from suffering. And I think when you realize that life itself is suffering and you change your paradigm around it, you can transform it.
Yep.
So first thing is it's a mindset that exercise that has to start with you, right? Don't externalize suffering or the problem. First of all, learn to embrace it, learn to transform it, right?
Yep. Move toward the painful rather than trying to always escape it.
Yeah. Yeah. It will ultimately set you free.
Mm-hmm.
I think that is the most impactful and cathartic mind shift that I think we can make today in addressing suffering, because that can happen now. Right.
Yeah. So let me clarify.
Yeah.
You're saying to a family that has no help for treatment, maybe no good insurance or no insurance at all, or no extra funding, or maybe they're on a waiting list for 4 months when their child is suicidal right now and they can't get help because the mental health clinics are all full. What you're saying to a parent is to embrace what the philosophers have been saying maybe for thousands of years. Instead of always trying to relieve pain and run away from it and avoid it, like, embrace what we have and shift your mindset and say, this is going to make us all stronger, and we're going to have hope, and we're going to be able to navigate this somehow, rather than being so petrified with fear that you can't do anything. Am I kind of getting what you're saying, or am I messing it up?
No, I think you are getting it. I mean, for a lot of people, especially in today's society, they equate suffering with shame. Like there's something wrong with me.
Yeah.
Right. Or this only happens to my family or my kid. When the
Yep.
reality is this is a universal problem, right?
Yeah.
And so, the antidote to shame is empathy.
Yep.
So having empathy for your family, your loved ones, for yourself, I think that's the start, right? And then going along with that is, once I can have that mind shift, then whether it's consciously or sort of subconsciously, let's just say you're a mother, Tony. You had mentioned, like, if you're a mom and you've got a kid, maybe it's a single mother thing we're talking about, is that kid's worry that you're going to reject him or her.
Yep. So
they're asking these questions like, do you accept me for who I am? Are you committed to me? Right? So I think we need to answer those tough questions, or ask those questions first about how committed we are to our child. How committed are we to the process of healing?
So something's triggered me a little bit, and that is, we're talking about the philosophy of suffering.
Yeah.
I kind of call bullcrap on that. because I think that's great for people who are not in crisis, sitting in an air-conditioned office to talk about. But when your child is trying to commit suicide, when you're sleeping on your child's floor because you're worried if you turn your back, they're going to go out the window or they're going to go out the front door and they're going to kill themselves, nothing else matters. And I don't think you care about the philosophy of suffering. I want to be able to speak to the heart of those families and those people who are dealing with acute crisis right now.
Well, so this is what makes podcasts fun. Because I know, Tony, that both you and I have lived this, not through the thousands of families that have paid us to take care of them, but through our own children.
Yeah.
And through our own neighbors, right? In my own community, I've lost 3 of my athletes in the last month, right, to suicide that I've coached in my community. And literally right now, in the last 48 hours, I've got a family crisis of a suicide attempt, right? So I go back to 30 years of running parent support groups for the families that have found treatment and found their way into our treatment centers. And in that group, I always invite them to do the same thing. As they tell their story, I invite them to at least share one thing that has blessed their life, right? All this crisis, all this pain, all this suffering, you have to share with the group at least one point. What is it about this? And I would guess that, and I don't have the statistical exactness, but I would guess that 80%, 8 out of 10 families, what they choose to share with that group is increased empathy for other people. And when you were talking, like I sincerely believe that it's like we do all this mindset stuff. And if I'm in a wrestling room or at a soccer practice and I'm volunteer coaching in a local community, and I can take an 11-year-old kid or a 9-year-old kid or a 15-year-old kid and teach them this concept of mindset as an athlete, it's actually not that hard to get conceptualized, even if it's the first time. And when I work with parents, when I have worked with parents, and I teach them how ridiculous especially our Western world has become to avoid pain and suffering, when the literal truth is that all things painful and everything that is meaningful in this life is connected to hard work and pain and suffering. So why do we avoid it so much? And so I know with my own family, when I'm hurting and when I'm the most afraid is when I try to change that mindset, embrace what's happening, and I tell my wife, I tell Diane, I'm like, let's sit with our pain for a while instead of being in a panic state, right? We need to sit here and cry and hold each other instead of worrying about a bunch of stuff that we can't control. And then we need to acknowledge and embrace the pain of our child, right? And we need to get in touch with that child so that we don't reject them, because that's their fear, even if they're complete victims of their circumstance.
I understand what you're saying. There's an Eastern, a Buddhist principle, I believe, that the chief source of evil in this world is, number one, trying to hold on to pleasure that needs to pass, and number two, trying to stave off pain that needs to come.
That needs to happen.
No, well put. I appreciate your challenge, Tony. I think as I've thought about this for a moment, I do believe we have to start with ourselves and our mindset. I do think that's very powerful. Okay, but practically, what do we do?
Yeah, I think that's where Tony was.
So
right.
Let's use an example that you have a child in crisis. First of all, that attribute I talked about of tenacity, you need it in spades. So first of all, you have to become the biggest advocate that you've ever been for your child, even more than you even think you can. As someone who's ran a psychiatric hospital, let's use an example of a pathway into the mental health system. So you have a child who's in crisis, maybe had a suicide attempt, a drug overdose. Their entry point at that point is probably going to be the local psych hospital, right? That admissions team, that utilization review team is going to make an assessment on that child. If it's an adolescent in particular, you want to be as involved in that process as you can be.
Yep.
And you want the diagnosis. Okay? Get the diagnosis. A lot of people say, I want my kid labeled. The funding follows the diagnosis.
Yep.
So get the diagnosis. It starts the clinical clock, right? What's going to happen then is based on that diagnostic profile, based upon the precipitating event, the clock's going to tick on, have 3 days of authorization, 7 days of authorization, what have you, right? You need to stay on top of the therapist you're assigned. You need to stay on top of that utilization review team and get continued progress. And here's something that people will have a hard time with. The better your child does in a psych hospital, the faster they will discharge them, whether they're ready to go or not. Mm-hmm. Why? Because what's the criteria for being in a psychiatric hospital? You're an imminent threat to self or others.
Yep.
So you want to make sure that you're curating and scripting language that if you know your child's still struggling, and I'll say it very candidly, you have to play the game.
Yeah.
You have to become very astute at what adjectives, literally, insurance companies look for when they authorize or they deny authorization, right? Mm-hmm. So I think that's a key point. Secondly, let's just say we move on and now we're looking at higher levels of care. We think the government knows a lot about us, and we think credit card companies know a lot about us. Insurance companies know more about us than anybody.
Yep.
And they already have algorithms when someone gets denied, how many people will drop out of the process right then. They already know that 80% of people will drop out. Now I'm only fighting 20% of my denials. They know through the second denial, as that process gets adjudicated, they know 10% more are going to drop out. And then by the time we get to the fourth or fifth appeal, they're down to 2 or 3% of the population. Then they approve it. Right? So that tenacity, that resiliency I mentioned, you have to have in spades because you have to understand the game that they're playing. It's all based on an algorithm, based on predictable human behavior. And so start with the mindset and then get aggressive and educate yourself on how funding facilitates treatment.
So your first answer was all about mindset and not being afraid of the pain and the suffering.
Yeah. But
that doesn't mean passivity.
Absolutely.
And then you go into your personal attributes, which you prize yourself on, which are, I'm going to be tenacious and I'm going to fight for my child. I'm going to be loud. I'm going to be boisterous. I'm going to be active. I'm going to be in the doctor's office, in the doctor's face. I'm going to be in the insurance company's phone call, and I'm going to stay online with them for hours and hours and hours and fight every battle.
Yes.
So that my child can get the help that they need.
And educate yourself on all of the different funding pathways. A lot of parents don't even know this. In a lot of states, school districts via the IEP process will pay for residential treatment and IOP, PHP treatment.
That's true.
Mm-hmm. Right? So find yourself an educational advocate or educational attorney, right? They can help guide you through that process as one example. So again, it takes work, but what are your alternatives, right? And so there is money out there for people that need help, but if you don't take the initiative to educate yourself and you remain passive, then you're not going to get the help.
Yeah. I have one more question for our two guests before we wrap up, and that is Craig and I have an opportunity to choose the topics that we address on this podcast. What do you see as the top 2 or 3 topics that you think we should put at the front of the list in terms of what we talk about?
Given your intended audience.
Yeah.
I think having experts on who are well-versed in understanding and communicating what trauma is and what it is not. The word trauma-informed care has become an empty bottle that everyone just fills with whatever they want to fill it with.
Yep.
And so I think helping educate your audience on what real trauma-informed care is, I think would go a long way to help people understand and navigate the space, number one. Number two, given the Telos connection and the high acuity that we focus on, is bringing in experts who can help parents evaluate what quality inpatient residential care looks like. I actually think that would go a long way, helping them create like a checklist.
Okay.
I think that would go a long way to help people. So those would be the top two.
So they don't get stuck in a program or a helping community or some place that is just going to churn them.
Absolutely, yeah. Because everybody's got a fancy brochure and website.
Yep.
Right.
Yep.
So those would be the first two.
Okay. What about you, Rod?
So I had very similar thoughts in terms of, how to assess quality care. So I'm going to put a little asterisk by that and encourage you to find that as a priority.
Yeah.
The other thing, we just mentioned it and Chris spoke to it, which is how to access care. What's the process to go through to access care, and making sure that you are choosing the right level of care, the right program, the right supports, whatever that looks like for your loved one who's in crisis. And then I think there's value in really understanding how to hold a program accountable, for lack of better terms, to what they say they're going to be doing, or whoever that person who's going to be caring for your loved one, and what that looks like.
Okay.
Excellent.
Yeah, thank you. Well,
great suggestions.
I want to again thank our two guests for being with us today. Thank you for the sacrifice of your professional time, for sharing your perspectives. In closing, I think I'd like to just speak to the people out there who are suffering, who are struggling. I know today we talked a lot about the 3,000-foot view. In future episodes, we're going to talk a lot more about practical realities and what do I do. There's a saying that says, all the darkness in the world can't extinguish the light of a single candle. And as dark as it may seem, as dark as it may feel, I'm here to say there is hope and there is light and there is healing. Even though it seems elusive, even though it seems like there may be a long list of professionals who don't care. I'm sitting in a room with 4 of my colleagues who've spent their entire professional life delivering help and healing and hope to families that are in situations just like you're in, or worse. So if you can find a way to reach down and grab a hold of that hope and find a way to keep pressing forward, it's worth it because the help is there. Anything you want to say in closing, Craig?
Yeah, 2 things. I think if we start a podcast and every podcast is depressive and gloomy, nobody will ever want to come back and listen to this. Maybe. So I appreciate you talking about hope. Dr. Leslie Feinauer, one of my favorite professors in grad school, she said, the worst thing you can do is give false hope, right? Mm-hmm. And so here, like we are living, breathing examples of seeing thousands and thousands and thousands of families and people that have had successful treatment. And so it's easy for us to talk about hope. But I guess in closing, so I just said let's not be gloomy, but in closing, my why, and the only reason why I'm not retired right now, it isn't the thousands and thousands of successes. It's the 24 kids that killed themselves, right? It's the friends and families. It's the close personal friends that have literally gone through this in the last week in my life, 2 weeks in my life, 3 weeks in my life, right? Employees and their children and clients that have graduated. It's the failures that motivate me. And so just as a sensitive piece of whoever may end up listening to episode 1 in the future, who treatment didn't work for, just know that our hearts are still burning for you, and that is the primary motivator, I think, for me for this podcast, is to try to save other people, I guess, from that experience.
All right. Hey, thank you for sticking with us. This was our first time. I promise we'll get better. In the meantime, keep the faith, and mental health matters. Thank you.